Mental Health Awareness Campaign is an annual global event which is celebrated in a week-long activity or sometimes month-long with the focus of achieving good mental health. It is an important issue, especially this pandemic. Everybody have been constantly exposed to stresses related to school, which has to adjust to new modalities, family and physical health issues. The fact that students, like mostly everybody else, have to stay at home, stress, anxiety, and depression is not an uncommon problem. Civic groups and governments all over the world have been espousing mental health awareness in an effort to address this worsening issue. The worst manifestation of which is suicide. So specifically to get people to talk about mental health and to get rid of the stigma associated to it. It is hoped that one day mental health may be an ordinary concern that receives equal attention as those given to other illnesses or crucial concerns in our daily lives. This year, in the time of the pandemic, in several studies, it was found that there is an increasing number of cases of reported COVID-19 pandemic-related adverse mental and behavioral health conditions. It was found out that there is an increased risk of psychological distress and unhealthy coping. And in some countries even, including our own, the use of telehealth or an alternative means of delivering treatment for mental health conditions, including depression, substance abuse disorder, and suicidal ideation. Is common. Scholars consider this as ways to reduce COVID-19 related mental health consequences. Researchers have also associated with the pandemic the various impact that need to be treated and prevented. In our university, faculty and students must conduct more studies on the adverse mental health and behavioral effect of the COVID-19 pandemic. Our university is a research university, and we should look into such factors, how they affect us, such as isolation, adjustment to the new modalities, and all those problems that we encounter that bring about social problems like depression or even sexual abuse is related. So in one of the papers that was conducted, study that was conducted last year, it was found out that during the early phase of the pandemic in the Philippines, the subjects reported moderate to severe anxiety, and many respondents reported moderate to severe depression and psychological impact. Indeed, the pandemic has been affecting our mental health, and coronavirus does not only bring us physical sufferings but also mental health. Maybe the mental part of it is even worse. The Department of Health, in fact, in partnership with the World Health Organization, is jointly raising awareness on the importance of public mental health, especially amidst the COVID-19 pandemic. So our country's National Center for Mental Health has statistics from online and teleconsultation interventions that even prove that there is an increasing cases of attempted suicide. So globally, it is proven that the effect of the pandemic on people between ages 15 to 25 um, seem to be the most vulnerable sector. So it is very important that we talk about this aspect of our health. In our university, it is time that we have effort to break the stigma. And this is done by the two colleges. The leading colleges are, of course, San Marcelino College of Teacher Education and the IBA Campus College of Arts and Sciences. And this is to lead the university in trying to address the very serious concern of mental health, especially among our students, because in the past we had cases where some students had suffered so much, and we also feel this way. This is so among some of our students. Even I myself, I could observe that some of the students are suffering depression, and when I see my students and they are sad, and even not focused, I think mental health is one of the factors that affect their well-being. So indeed, our university needs to seriously pursue these interventions, and it is noteworthy that our gender and development coordinators and of course our extension coordinators are focusing on this aspect of health and well-being of people. You know. We long to of course be with you, our students, and even as we are affected by the pandemic in this way, that our mental health is also affected in the same way you are affected. You know, in the Philippines we have a law that is Republic Act 11036, or the Mental Health Act, which mandates the provision of comprehensive mental health programs and even suicide intervention services, and it encompasses crisis intervention and a response strategy on a nationwide scale. Dear students, you know what I can say is you are not alone. People around you are suffering stress. Many haven't been able to work. There is lack of financial resources everywhere, and many have lost their jobs, and some have difficulty of going back to their own home provinces or hometowns, and they are affected by related deaths of people close to them. The feeling of depression, hopelessness, isolation is a challenge that we can say all of humanity is experiencing to some extent, and that we must overcome in this age of lockdown. So there is this representative from the World Health Organization in the Philippines, Dr. Rabindra Abeysheng, who said that we are not facing this alone. With compassion and understanding for others, we can recognize the signs and educate ourselves on how to access help and how to help. I must add, knowledge is not only power, but it is the key to freedom from mental health problems. San Marcelino campus started mental health awareness advocacy last year with the faculty and non-teaching personnel of the university. It is a noble and important milestone for our university. And this time, I must mention, I would like to recognize that most of our campuses have joined in this year's program to cater also to the mental health concerns of our students. So dear students, this program is for you. So I hope that you will gain something that will help you start to, or that will help you or start to help you understand more deeply and to be able to deal more effectively with this issue of mental health, whether personally or those of your loved ones and friends. So with this, have a fruitful time everyone. Enjoy this webinar.